Thanks everyone for joining us today. This is the NACDA Data on Aging podcast. And if you haven't listened to before, we are a data archive and we promote gerontological research. And today we are talking with Dr. Scott Roberts, who is a professor and in the Department of Health Behavior and Health Equity at the University of Michigan School of Public Health. He's the Associate Director of the National Poll on Healthy Aging and Director of the Outreach, Recruitment and Engagement, also known as CORE, Michigan Alzheimer's Disease Research Center, MADRC. His research focuses on the use of genetic and biomarker testing in Alzheimer's disease, mental health, and aging. And he's got some exciting endeavors going on related to caregiving and mental health and wellness of aging individuals. So thank you, Dr. Roberts, for being here today.
My pleasure. Thanks for having me.
Yeah, so we're going to jump right into the questions. And why don't you talk about how you got involved with aging research?
Yeah, well, it's been quite a while. It's been doing this for over 20 years now, and it's interesting. It's not something I would have predicted when I was doing my PhD in clinical psychology. If you had told me I'd be doing anything with Alzheimer's or genetics, I would have thought you were crazy at the time. But I ended up, I was looking for a dissertation topic, and I happened to be doing a practicum at Duke University back in the late 1990s. And this was a time where they had just identified this link between this ApoE gene and risk of Alzheimer's disease. And so it was posing all these interesting questions about should we be offering this kind of genetic testing, given that Alzheimer's is a serious incurable condition? How were family members thinking about this kind of risk information that they might get from a genetic test? And so that kind of sparked my interest, and I ended up, doing my dissertation on um, relatives' attitudes and beliefs about this kind of genetic testing. And so that one thing led to another. That got me then involved when I was at Boston University, not just surveying people about what do they think, but actually offering the test to people and seeing how do they respond psychologically and behaviorally to learning this kind of information. And so that interest in aging and older adults on the research side also was paralleled in my clinical work. I'm a clinical psychologist by training, and so I've over the years done some clinical placements in different mental health settings, working with older adults, a lot of veterans, and so I just found that I really enjoyed working with older adults on the clinical side, even though I don't do clinical work any longer. That was also kind of a big impetus for me to get in the field is that focus on trying to improve mental health and wellness outcomes for older adults. So those were some of the ways I got into this.
Great. Yeah. Um, Quality of life is definitely something I think we all think about, as much as we think about aging. Uh, what kind of care you're going to have is usually secondary to that, or maybe not even necessarily on the radar until it has to happen. But yeah, like our engagement in our lives, it's um, definitely a factor. So what would you say are the central objectives of recent work for you? And talk about any recent projects you're on.
Yeah, so about 3 years ago, I became the associate director of U of M's National Poll on Healthy Aging. And so this is a really exciting project where twice a year we survey a large nationally representative sample of adults age 50 and above in the United States. And so we've done surveys on a whole range of topics. And so one topic that's particularly of interest to me that we focused on recently was older adults' experiences and views on early detection of Alzheimer's disease. So we asked people, for example, have they undergone any kind of cognitive screening recently. There are ways in which we can do these very brief, memory and thinking tests to see if people might have some issues going on. There's also some really interesting new blood biomarker tests that are now coming on the market where a simple blood test can tell you whether you have the presence of amyloid plaques or tau tangles in the brain. And these are, kind of early potential signs of Alzheimer's disease. So we were interested, are people doing these kinds of screens and tests? What do they view as the pros and cons of it? So we did one of our national poll modules was kind of a set of questions on that topic.
Oh, wow. Yeah. What's the age range, would you say, for the National Poll on Healthy Aging that these people are getting asked these questions, specifically?
Well, the general poll is age 50 and above, but
Mhm.
given the focus of this topic, we ended up looking at people age 65 to 80 because we thought it
Yeah.
might be more relevant once you kind of are, on Medicare or maybe getting into the age where you might be at risk for developing Alzheimer's disease. So for this particular module, we focused on an older slice of the sample, but the general poll we typically ask age 50 and above. So it
Wow.
depends on what your definition of older
Yeah.
adults is. Now that I'm eligible myself for the poll, sometimes I feel like I like to say middle to older age adults, but but for many of our surveys, we survey a wide range of people age.
Yeah. Well, we believe that the life course includes pretty much everybody, but we try to, but NACDA focuses on older adults mostly. And so, yeah, most people, when they hear that, they think midlife to older. So I think that's fair. But yeah, it's understandable that for these specific modules that it would be even older cohort. Um, but yeah, that sounds really interesting, especially that there could be like wider access to blood tests that it's like maybe you prick your finger and it tells you something that you might be vulnerable to. That's wild.
Yeah, I mean, right now, that kind of biomarker testing is usually only used with people who have some cognitive impairment.
Hmm.
So it's often, for example, a physician might be wanting to figure out, well, I know this person is cognitively impaired. Is it Alzheimer's that's really driving it? Is it other, there's other kinds of dementia you may know about, like
Hmm.
vascular or Lewy body. So I
Yeah.
think these kinds of biomarker tests right now are being used to help in what we call a differential diagnosis, really trying to figure out what's the underlying cause of cognitive impairment. But in the future, I think you could imagine a model of care where these blood biomarker tests would be used as kind of an initial screening test. And then if the person does test positive for these biomarkers, then they might get some more intensive assessment. They might get referred for, kind of deeper neuropsychological testing or additional neuroimaging or, things like that, where they could maybe take a deeper dive. And I think a lot of this depends on us having better treatments for the disease. And so we have had in recent years a couple new FDA approved medications for Alzheimer's disease. So that's been a very welcome breakthrough. But even so, right now the treatments we have really just kind of slow the progression of the disease. They don't, stop it in its tracks. And it's not like we have anything that we know for sure will prevent Alzheimer's. So the more we have improvements in treatments, I think the more both patients and providers will be excited about using some of these screening tests because then they feel like, they have more to offer
Yeah.
if there is a positive screen.
Yeah. Yeah. That makes sense. So, you mentioned the National Poll on Healthy Aging, and this particular these particular tests and cohorts. Would you like to talk a bit about some of your major findings related to this work?
Yes, so in terms of the blood biomarker tests, we found that, not surprisingly, very few people have had one of these kinds of tests. They're really just coming on to the market, and like I said, are usually only used in the context of people with some kind of existing dementia. And relatively few people were even aware these are out there. So we found that, less than 20% of the people we surveyed had ever heard of anything even like this. So I imagine that will change over time, but that was, some of the findings we had on the blood biomarker tests. Um, we also asked, though, about, a kind of test that's perhaps more familiar to folks, this idea of cognitive screening. So I think I mentioned earlier, a lot of older adults are probably familiar with these. They're often like pen and paper kind of tests, or give somebody a brief word list and ask them to kind of remember a few words and then repeat those a few
Sure.
minutes later, or draw a clock. There are these things like that can be done in a relatively brief period of time that are used for kind of screening for memory and thinking problems. So we found in our study that most older adults, over 70%, were aware that cognitive screening existed, and about 40% said that they had ever themselves actually undergone screening. And only about, I think, 20% said they had done that in the prior year. And this is even though I think Medicare covers this kind of
Oh,
screening,
wow.
and some groups do recommend that we be doing this more routinely. And so it was interesting that we've seen that kind of relatively low rate of utilization of cognitive screening. And it also differed by demographic factors. So if you were in a more educated bracket, you had more likely undergone this kind of screening. If you had a family history of dementia, it was more likely you had done this kind of screening. But then interestingly, people of Hispanic um, or Asian race and ethnicity, those groups were less likely to have had screening in their experience. So it kind of points to some of this kind of lack of routine use of this, and the fact that it's not happening at the same rate across different groups. So it kind of led us to wonder, well, are there ways we could maybe address some of these disparities in kind of use of screening moving forward?
Yeah. Yeah, that's really important. We definitely want to make sure everybody is aware of those resources that are available. And yeah, I'd be curious to also know if, I don't know, the area somebody lives in affects, you know, their access to information about these resources, or other things like that, um, that may be factors.
Yeah, I think this issue of kind of access to care is really something we talk about a lot in public health, and um, insurance status is important. But even if people are insured, in a lot of rural areas, for example, they may lack proximity to
Hmm.
good care, particularly when we talk about dementia. Oftentimes, um, ideal care is through a specialist like a neurologist or a geriatrician. So a lot of
Yeah,
times, primary care physicians aren't as equipped to kind of make a sophisticated diagnosis when you're trying to, like I was talking about earlier, distinguish between the many potential underlying causes of a dementia. Sometimes that's best done in a specialty care setting, but older adults may lack access to those kinds of resources.
yeah,
Or
yeah.
the wait lists, I know, at least here in Michigan, are pretty long, to be seen in those kinds of specialty care settings.
Sure, sure. And if you're having a hard time just getting to your primary care physician, you don't want to think about having to go to yet another physician that's a specialist, even though that is, the best way to address it. So yeah, there's lots of challenges around that. So, so we're naturally shifting into talking about some of the challenges of the research process. And yeah, I'd be curious to hear more about what you've noticed as challenges, related to the National Poll on Healthy Aging, but also just in general, with the work that you do with mental health and wellness for older adults. Yeah.
Yeah, well, the nice thing about the national poll is, we partner with this public opinion research group, NORC, at the University of Chicago. So they help us address one of the biggest challenges I've faced in other areas of my research is really being able to find research participants who are representative of the broader population. A lot of the studies I've done, our findings have been hampered a little bit by the fact that we don't get diversity in terms of, kind of socioeconomic status or race, ethnicity. We tend to have our groups that we connect with are, kind of skewed more towards white, higher educated groups. So the nice thing about the national poll is it really is a nationally representative sample in terms of a lot of the major demographic factors that we think about as influencing health and health status. Um, but in a lot of other areas of research, I think that challenge of kind of sampling is really prominent. Another challenge I've noticed is, we can kind of describe problems and issues, but really kind of translating our findings so that they make a difference in terms of informing intervention, informing policy. That's a lot easier said than done. I think we've done a good job, I think, of publicizing our work, publishing it in academic journals, but that doesn't necessarily mean that it moves the needle in terms of kind of improving. You mentioned quality of life earlier, so I think that's, a big challenge is that translation piece, particularly in an environment where I think more and more people are kind of, health expertise has been devalued in a lot of ways when you look at, you
Yeah.
know, who's running NIH now or HHS, this idea of kind of how seriously academic research findings are taken has been an issue.
Yeah. Yeah. As far as the outreach and what you all are doing, I think that the NPHA website looks really great. And I love that there's these easy reports that you can access. Um, and they're organized in a nice, clear manner. And then it was funny, I was just on my phone the other day and I came across an article that referenced the Michigan poll on healthy aging too, which is related. Um, but yeah, so like hopefully it is getting out there. But yeah, we definitely need higher level policy decision making related to this work for sure. Um,
Yeah, yeah, that
yeah.
state poll is something that we've started more recently with the support of the Michigan Health Endowment Fund. And so we thought it would be nice to have a companion report to our national poll that reports on, what are Michiganders thinking about and how are they responding to the same set of issues that we ask about in our national poll. So, um, yeah, what we do in our poll is we try to put out a pretty user-friendly report on our findings that we do disseminate in a variety of ways. And you mentioned our website, and we have a great communications team, so we try to put out press releases that are often then picked up by major media outlets. So that's another way to disseminate our results. And then those reports are often then the basis for kind of more in-depth uh, pieces that then become academic peer-reviewed journal articles. So a lot of our studies aren't just put out in that general report form, but then, also appear in the academic literature. But the first step is really to kind of get the report out. That's, the main findings,
Mhm.
but in a lay-friendly way that can be used by a variety of stakeholders, whether they be policymakers or just older adults in general. So we try to put things
Yeah.
in a variety of formats.
Yeah. Yeah. Easily digested, right?
Yeah.
Um, Yeah, and you mentioned NORC. Yeah, we love NORC. They give us the NSHAP data, the National Social Life Health and Aging Project. And so yeah, it's great to hear. It's always great to me to hear about uh, you know, the interconnected nature of researchers' work, and the different ways people sort of work together. So thank you. Yeah. So you mentioned recruiting can be a challenge and making sure you have diverse samples. And so, just thinking about the National Poll on Healthy Aging and some of this work with longitudinal research, research on caregiving, what advice would you give to other researchers who are interested in doing the same kind of research or just even working with longitudinal data? Like if you've come across things where you're like, if I were doing secondary analysis, this is what I would do.
Yeah, I think networking and connecting with kind of groups that can give you that kind of access, you don't have to beat the bushes yourself to find people. I think the NPHA, to be fair, though, we are not a longitudinal study, so it's kind of each module is as a cross-sectional look at older adults' perspectives. But we do make our data publicly available. And so I think if researchers are interested, we on our website, we release the raw survey data for use. We have a fantastic data analyst, Matthias Kirch, who uh, has put together kind of a how-to video on our website. And then we have kind of access to the actual survey items that we use, the original wording. And sometimes we take validated survey scales and use them in our polls, but a lot of times we're just creating new questions ourselves. And so all those are cataloged on our website. So we try to make it as easy as possible for folks who are interested to kind of be able to take what we've put together and design their own secondary analyses to report on findings. Because even though we try to summarize things in our reports, we don't, all, but maybe we don't look at differences by a particular variable that others would want to, and we don't report on everything. And so I think it is a great resource for researchers interested in aging and health. Um, but one switching gears then from the NPHA to my Michigan Alzheimer's Disease Research Center had, that is one area where we do have a longitudinal cohort study of older adults where we follow them annually and we do a very intensive assessment of them. And so part of the reason we do that is that's not just a study in its own right, but then it serves as a registry for us to connect people with other researchers on campus. And not just on campus, we work with Michigan State, Wayne State, people outside of U of M, who might be interested in recruiting people for their own studies. And so that longitudinal cohort can be a way that we can match people with, hey, there's a study looking for, 25 caregivers of people with dementia, or you need people for, who you absolutely need to be sure that they have what we call mild cognitive impairment, that, they're not normal cognitive functioning, but they're not to the point where they have a dementia. And so, in this study, through our intensive assessment, we're able to really characterize people very specifically. And so that is a resource for researchers as well. For maybe we don't have the numbers in that study that, the national poll, we're often surveying thousands of people. But at least for some of these smaller studies where they need kind of a very particular subset, we try to, through our MADRC work, link researchers with people in our registries.
Great, thank you. Yeah, I think, you know, the National Poll on Healthy Aging, like you noted, while it's not longitudinal, that cross-sectional work is still really valuable. But yeah, it's great to hear about both of those projects and the different, um, the different ways that they work and I think that most problems are not solved by one thing, right? It's a multifaceted approach, and aging research and then, improving health outcomes is also like that. So that's great. So, what excites you about being a researcher now?
Well, I think it's been gratifying for me to see the focus on aging and health that is here, not just I'm in the School of Public Health, but across the University of Michigan. There's so many centers now that are focused on these issues one way or the other. And so I think we have a fantastic network of folks here who are thinking about these issues from a lot of different angles. who are trying to make that link between research and practice and policy. Um, and so I'm optimistic that U of M can play a leading role in kind of leading the way and thinking about addressing these problems. And I think it's imperative that we do so because if I'm sure you guys know, if you look at the kind of demographics of our society, it's really um, older adults are increasing in number. They're increasing in terms of the complexity of issues that they present. I know within older adults, it's the 85 and up group that's that oldest old groups that's the fastest growing group. And so I think we really need to prepare our workforce to address the needs that these demographic shifts are going to have over time. And then in my own world of Alzheimer's disease, I think there's a lot, I kind of alluded to, these new treatments coming on board. There's a lot of exciting work that's happening. And so I do think we're going to be able to offer people more than ever before, but I think a lot of it does depend on professionals coming together, partnering with communities in
Mhm.
ways that are going to have meaningful solutions to these problems.
Thank you. Yeah, and earlier you mentioned networking and how important that is. And again, you mentioned people coming together to solve problems. And so I normally like to throw in a question to say, um, are there any conferences or meetings that you really like to attend that you find really valuable and that give you the chance to do this kind of connecting that you talk about?
Yeah, I think at the national international level, I almost always go to there's this Alzheimer's Association International Conference that happens once a year. So this year it's going to be in Toronto at the end of July. And so that's the biggest scientific meeting in the world around Alzheimer's research. And so I find that to be a great meeting. The Gerontological Society of America is a great organization focused on a lot, social science and aging research. That usually happens every November. So those are two national meetings. But then more locally, I think we have an aging network within IHPI. I don't know if you guys have heard about the IHPI is the Institute for Healthcare Policy and Intervention. And so my colleague Erica Solway, who's the deputy director of our national poll on healthy aging, she has helped organize this group of aging and health researchers where, she has a great listserv that puts out good information, but we try to have kind of periodic meetings and special events within that group. So that's kind of a nice way to kind of locally be connected
Cool.
to folks at Michigan.
Great. Thank you so much. Yeah, it's been so nice to talk with you today about this and get some insight into the National Poll on Healthy Aging and into Alzheimer's and related dementia research. So yeah, it's encouraging to hear that, you know, there's, you know, new tests potentially and that there's an ongoing effort to try to delay at least um, Alzheimer's and dementia, but hopefully the work continues and
And I
keeps
guess
making an impact. Yeah.
being a psychologist, I should also mention, and being in a Department of Health Behavior, I think there's also been a lot of attention to not just to the medications that could hopefully be beneficial, but what can people do for their own brain health to lower their chances of Alzheimer's and related dementia. So I think that's another interesting area is, how do we help people engage in healthy behaviors that are going to be useful not just for their cognitive health, but their physical health. And a lot of these things are things we talk about in the context of other diseases as well, whether it's physical activity, eating
Hmm.
healthily, staying socially connected, staying mentally active, those kinds of things.
Right, right. Trying to keep learning something new, on a regular basis to engage your brain. Yeah, those are definitely great activities to engage in.
I'm hoping my addiction to Wordle and spelling bee on the New York Times app will help me out someday.
Yes, same. not Wordle, but just other things like Duolingo, all these fun little apps that make learning easy. So, well, thank you so much for talking with us today. And is there anything else you'd like to add?
No, I think it's been great sharing with you. I hope this is at least somewhat useful to your audience. And yeah, people listening to this can certainly feel free to reach out to me with any questions they would have about specific resources I've mentioned.
Oh, great. Thank you. Thank you so much to our guest and to our listeners for joining us on this podcast. You can find links to studies we referenced by viewing the description and content below. If you have questions or ideas, please email us at icpsr-nacda@umich.edu.